My name is Phyllis Amon, and this is Senior News for Today. In the news, in the Next Avenue article, COVID-19 and the Future of Aging, the Medical Path Forward for Older Adults, Dr. Philip Pizzo, the creator and founding director of the Stanford Distinguished Careers Institute, and the David and Susan Heckerman professor, former dean at the Stanford University School of Medicine, and one of Next Avenue's Influencers in Aging 2015, states that the risk of the coronavirus for older adults has exacerbated attitudes of ageism. He goes on to say that some are of the opinion that, quote, if it weren't for old people, the impact of COVID-19 would be more tolerable. Yet even though the risk of mortality from the coronavirus is greater for older adults, mortality and morbidity of COVID-19 has been observed for people of all ages. Although the virus's mortality is highest for older adults, risk increases as one's age advances through each decade. According to the article, for individuals between the ages of 40 and 49, there are 8.6 deaths per thousand individuals, while it is 105 per thousand for those between the ages of 65 and 74. It jumps to 210 per thousand for those between the ages of 75 and 84, and goes up to 304 per thousand for those over the age of 85. He goes on to say it's important to remember that vulnerability and fatality can vary from one pandemic to another, and that blaming any one group for outcomes they cannot control is entirely inappropriate. Hypertension, obesity, and diabetes, the underlying conditions that make one more vulnerable to COVID-19, are also conditions associated with older adults. The fatality rate for COVID-19 is higher in men than women, and is also negatively associated with race and socioeconomic status. Dr. Pizzo suggests this means that until the population has received an effective vaccine and our treatments, older adults will need to shelter whenever possible and to practice social distancing with masks and hand hygiene. He also recommends that if older adults are living in multi-generational homes, they must be increasingly aware they are more vulnerable to transmission from younger members of the household. Healthcare delivery also now is more accessible through telemedicine, allowing healthcare providers more access to their patients, which also means that older adults will have to become more comfortable with technology. Science is doing its part, and policymakers must as well. Lives can be saved if evidence is followed and leadership responds accordingly. If that happens, older adults and people of all ages can look forward to healthier futures, even though it may take some time to get there. Please like and share this episode, and to continue receiving Senior News for Today, please hit the button below to subscribe. Until next time, stay safe, stay well, and stay tuned.